Where do various agencies stand on allowing PTs to discuss nutrition?
So even as a student, and for a long time, I've just been a fan of nutrition, and I love nutrition, and I think it's something that everybody needs to know. And we as PTs, why in the world would we even talk about nutrition on this podcast? Is that nutrition fuels our bodies. So I've heard therapists talk about various little things, but it felt that everybody they would say a little bit and then they get withdrawn because they don't know what they can say and what they can't say. So in November of 2017, so 4 years ago, the APTA said that their stance is that nutrition is within the scope of practice of physical therapists. So that's where the APTA stands. However, there was the caveat of where they said, look into your state's Practice Act and see what the Practice Act says. I'm not going to go through all 50 states, but we'll talk about Tennessee, given that's where we are. And Tennessee basically says that nutrition and diet, in quotations, are not mentioned in the Practice Act. So it doesn't say that we cannot say that. It also doesn't mention it for physicians, dentists, chiropractors, or nurses. So we would expect that a physician, sometimes we say, yeah, go talk to your doctor about it. That also doesn't set it in their act. So by all intents and purposes, it seems that it doesn't disallow us to do that. On top of this, the Center for Nutrition Advocacy essentially says that nutrition isn't one sort of profession's tool set. It is across all professions, and you can basically use it to give good patient care. So they effectively allow us to do it. The bottom line of all of that is you can talk about nutrition as long as you do not label yourself as a dietitian, because we are not, and as long as you do not specifically bill for diet purposes. What does that mean? Because that's the gray area that people can sometimes get into. We bill for education all the time. Education is definitely something that you can do for patients. What is the purpose of your giving them nutritional advice? If you're saying, hey, I'm trying to give them advice to help them lose weight because they have bilateral knee arthritis, and we know that losing weight is greatly going to reduce their pain. Perfect. That you have a diagnosis that PT is meant to treat, and you're helping them improve that diagnosis. That works. Now, if you're just saying, hey, I saw this great diet and you should try out this diet, no, that doesn't necessarily mean that. But as long as you're not billing for diet, you can absolutely talk about it. That's sort of the bottom line. If you are in a different state than Tennessee, check your Practice Act, but most of the time it's just completely left out.